The National Debt Service in the UK loses around 95 million every year on missed appointments. And that's not because the technology doesn't exist, it does. And we have built it. But it's because healthcare is the one industry where you cannot ship a product and then figure out the compliance later on. And most founders are learning that the hard way. By the way, I'm Ahmed, founder of AsTechware, and we have built regulated systems for different industries. And today I'll be sharing how we built and what we learned when on building a HIPAA-compliant AI system for a dental clinic in the US. A US dental girl came to us with what sounded like a simple ask, let patient book appointments by voice and give their doctors an AI scribe so they can stop writing clinical notes at 10 p.m. every night. Simple ask, right? But serious problem underneath. Because the moment the patient speaks to the phone, that audio becomes protected health information. The moment we transcribe it, the transcript becomes PHI. And the moment we send that transcript to an AI model to understand what a patient wants, it becomes a regulated entity, sending up, health information to a third-party provider. One wrong prompt or logged issue on the server, makes the clinic lose their operation. So not a fine, but they will lose the ability to operate. And that's a very serious problem. So how we handle it, we build the identification layer that sits between the audio and the AI model. So every information like the phone number, their email, their name, any kind of information will be replaced with a token. Right. So, for example, a patient A called for a cracked tooth, and that information will be sent to the A model, and after the A response, that information is again synced with the token, and sits in the system with real patient information. So that becomes a defensible compliance system. And that single project taught me something that applies to every healthcare AI system in anywhere of the world. The hardest part is not the AI; it's the how you flow the data between your systems. So this the one thing that is most important in any regulated industry. And recently, I started exploring the UK's healthcare AI market, and what I found was fascinating. The UK's National Health Service, the NHS, is one of the largest healthcare systems in the world. 147 hospital trusts in England alone, millions of patients, and right now, AI adoption is absolutely exploding. But here's the problem. There is no mandated AI regulation in the UK right now, which sounds like a good thing if you want to move fast. But in healthcare, which is actually a nightmare, because what is happening in NHS trusts are procuring AI systems has almost no AI governance. Senior, leadership has no questions like what they ask, and it's like one buys the system and the neighbors trust it, and they say like we need it too, just not because they have identified a clinical problem, but just because everyone has it. And they're not asking what problems we are solving with AI. They are just like what everyone else has, so we need it too. And the manufacturers are making it worse too by hiding what how their AI works, because they say like they cannot explain how it works because it's proprietary, and that is not acceptable when the output of your AI is influencing the patient care. So the EU AI Act is now mandated across the Europe. The UK is expected to follow its own framework. and there is a new international standard called ISO 42001, which is specifically an AI management system standard. The equivalent of what is ISO 27001. It is for information security, but for AI governance. Um, and that is the regulated way of coming. And founders who are ready will own the market. In the US, the main frameworks you deal with in healthcare are HIPAA, SOC2, and for certain AI products, it's the FDA part. Um, in the UK, the equivalent is a set of standards called DCB 0129 and DCB 0160. And every piece of software that touches patient care in the NHS must go through a formal clinical risk management process. You have to document every single way your software could harm a patient. You have to appoint a clinical safety officer who must be a registered clinician to sign off and say, like, the system is safe. And without that sign off, you cannot legally enter the NHS. And so different labels, same core principles. Prove your AI is safe before it touches the patient's data. And here is what I tell every founders on who pushes back on this. Regulation is not a burden, it's a moat. The founders who go through the proper regulatory pathway become trusted and they become the default choice for procurement. And the teams who are terrified of getting it wrong, the one who skips it, get fast to the market, but then gets small or worse, like they just gets shut down. If you are a founder building in healthcare AI or thinking about it, here's what I would suggest you. One, get a clinical partner before you write a single line of code. You cannot build healthcare technology without experienced clinicians on the journey with you, not as advisors, but like as active collaborators who understand the clinical workflows you are automating. Second, start with administrative AI, not clinical AI. The low-hanging fruit in healthcare is enormous. Appointment management, documentation, patient communication, billing. This is where AI performs brilliantly right now, and where the regulatory risk is manageable. Don't go straight to diagnostics or clinical decisions reports and all that stuff. This is high risk and harder to prove safe. So walk before you run. And then third one, pick your regulatory framework before you build. In the US, that means understanding HIPAA and whether you need FDA clearance. In the UK, it means DCB 0129, DCB 01260, and DTAC or ISO 42001. Know which one applies to your product before your first sprint. The market is definitely massive. There is no doubt about it. And NHS alone is a multi-million opportunity. And most of the AI being deployed in the healthcare is done poorly. The bar for doing it properly is not that high, but you just have to actually clear it. So we're actively exploring how our US healthcare AI experience translates into the UK market. And if you are a founder building in this space, or you are a healthcare organization trying to figure out your AI strategy, and I would love to connect. Drop a comment below and tell me where you are in your healthcare AI journey, and let us know because we are going to be covering this a lot. And I'm see you in the next one. Bye bye.